My name is Jason Kelly, and if you can see me there, I did my project on hallucinogen persisting perception disorder. And hallucinogen persisting perception disorder is often abbreviated as HPPD. It involves the lingering presence of visual disturbances similar to those caused by ingesting hallucinogens, and the actual use of hallucinogens is a prerequisite for diagnosis. You can't have HPPD without not having ingested hallucinogens. But at the same time, having ingested hallucinogens doesn't guarantee that you do have HPPD. The symptoms of for it to be HPPD, the symptoms can't be from another medical condition. HPPD symptoms are not flashbacks because they are permanent. Flashbacks are temporary. These symptoms are permanent, which is pretty discouraging for people with HPPD. It is on the DSM-V4 with the diagnostic code 292.89 in case you want to look it up for fun sometime. Certain symptoms associated with HPPD are halos or auras surrounding objects, trails that follow objects which are in motion, difficulty distinguishing between colors, shifts in hue, which we learned about, the illusion of movement when you're in a still setting. And when you have HPPD, air appears grainy or textured. A lot of the people who have it describe it as air looking as snowy or static-like. There are also distortions in dimensions when perceiving objects, and a heightened awareness of floaters. There are variations in symptoms. Each person has a different amount of visual aberrations, and the intensity varies for everyone. These types of aberrations also appear in healthy persons, but what distinguishes these aberrations in healthy persons versus people with HPPD is that illusions in HPPD patients are far too intense to ignore. They often experience after images after staring into light, floaters in the eye, and they perceive specks of light in darkness sometimes. The difference between a healthy person experiencing some of these symptoms and a person with HPPD is that for persons with HPPD, these are completely new visual disturbances. They're not like an intensification of something they've had in the past. You know, not like if you had a floater in your eye, it's not like it's been intensified. These are completely new disturbances. And these visual disturbances are not clinical hallucinations. Like with schizophrenia, we associate hallucinations as certain experiences where you're not sure whether or not they're real. With the visual disturbances caused by HPPD, the patients realize that it is not real, that they're just experiencing it. They're certain that it's not real, whereas a schizophrenic person actually hallucinating would not be sure if it's real or not. They are considered illusory visualizations or pseudo-hallucinations. That's the term they refer to for HPPD persons. Research on HPPD indicates that the probability of developing it after ingesting hallucinogens remains unknown, which basically what we know is that we don't know the probability, which is not a good thing. Most hallucinogens are illegal, which makes research difficult and in certain cases unethical. Such research could have been done in the Netherlands legally up until about 2 years ago when hallucinogens were finally re-outlawed. They were made legal for a period of time, and it would have been legal to do this research, but technically legal. I'm not sure that it would be ethical, but it no longer is legal in the Netherlands anymore. David Kozin, a gentleman who is designing an HPPD research program at the McLean Hospital, which is a psychiatric hospital in Massachusetts, and the program is in conjunction with Harvard Medical School, so this is pretty exciting. Causes of HPPD. The physiological causes of HPPD are unknown. Current neurological research indicates that symptoms may be due to abnormalities in the central nervous system functioning following the use of hallucinogens. One theory states that inhibitory mechanisms involved with sensory gating are disrupted with persons who have HPPD. Occasionally, these HPPD will occur after a single use of hallucinogens, which is kind of scary. It makes me not want to try hallucinogens because it does, in rare cases, occur HPPD in people after just trying hallucinogens once. But this suggests that drugs play a direct role in triggering the symptoms. But again, that's just an occasion. That's not very often. For the most of the time, what happens is people actually have a gradual worsening of symptoms, not a sudden onset. And this is associated with ongoing drug use rather than just one-time use. That's far more common. Drugs that are associated with HPPD are LSD, acid, MDMA, ecstasy, psilocybin, which is what we young folks call shrooms. Of course, I don't use them, so what other young folks call shrooms. Another drug that's associated with it is mescaline, which is what Native Americans in Mexico use for spiritual rituals. Also, diphenhydramine, which is an over-the-counter antihistamine, is associated with HPPD development. Mephedrone, PCP, as well as high doses of dextromethorphan, which is a cough suppressant, and high doses of Ambien, which is a sleep medication. In some cases, the abuse of Adderall has also triggered the onset of HPPD. For my first article on HPPD, I did Matthew Baggett and his colleagues in 2006 wrote an article, Prevalence of Chronic Flashbacks in Hallucinogen Users. And at the University of California, Berkeley, they conducted a web survey, and they asked those surveys about their experiences with hallucinogens. They asked them how often they've used them, if they've ever used them at all, and any lingering effects after having used those hallucinogens. And of those surveyed, only 4% of hallucinogen users suffer from HPPD. And of those 4%, only 15% claimed to experience, claimed to seek professional help. So there were 4% of those 4% of people surveyed claimed to have HPPD. Of those 4%, only 15% sought professional help. And of those 15% that sought professional help, only 2% were diagnosed. My critique of the first article is that the web survey probably overestimated the prevalence of HPPD. People with visual disorders might have been more likely or more interested to fill out the questionnaire because of volunteer bias. And only 16% of participants who actually viewed the survey filled it out. So that just strengthens my argument for volunteer bias. People were not formally diagnosed in person, so that affects the results possibly. Also, there's the issue of the social desirability bias. Because of the illicit nature of hallucinogens, certain people may not want to admit to having used them or using them online, because certain people, may be concerned about surveillance on the internet or just, the social desirability aspect of it. People don't want to admit to conducting illegal behavior sometimes. My suggestion is that he should have conducted it in person on a large metropolitan college campus, such as UCF, because it offers a reputable cross-section of society of people who have used a variety of different drugs, people who haven't used them at all, rather than where he did it at. For my second article, I did an article entitled Hallucinogen Persisting Perception Disorder, What Do We Know After 50 Years? And it was by Halpern and Pope, written in 2003. And John Halpern and Harrison Pope evaluated 500 different Native American church members. Each of those 500 members had taken hallucinogenic cactus, which is named peyote, on at least 100 occasions. So of those 500 members have taken this hallucinogenic cactus at least 100 times, if not more. And their data what they found was that the data does not permit them to estimate even crudely the prevalence of strict HPPD. So it just goes on to reinforce that we just don't know much about HPPD. There's not much research, and but my critique of that article is that they should have diversified their sample population. They specifically picked 500 people who have had tried this hallucinogenic cactus 100 times or more. So it's very manipulative. All their members are of the same genetic line. They live on the same reservation in the same region of the country, of the same ethnicity, so that may have affected the results. You typically want to have a very random sample of, a very random group of people to conduct research on. Conducting research, my suggestion would be to conduct research again on a university campus or a large metropolitan area where you have a lot of diversity in terms of genetics, ethnicity, and as well as the range of hallucinogens used. They simply dealt with people who have only used cactus, hallucinogenic cactuses. In a large college campus or metropolitan area, you have people who have probably tried a variety of different hallucinogens. As far as treatment of HPPD, there is no cure available, which is pretty discouraging. The current treatments seek to reduce symptoms in distress without treating underlying causes. Klonopin, Valium, and Xanax are prescribed with a fair amount of success.